My name is Heidi Dubois. I am the Business Optimization Manager at Neosis. Tonight, I have the honor and the privilege of introducing you to one of our Yomi experts, Dr. Kara Toulson. Without further ado, Dr. Toulson, if you would like to take it over, here you go.
Thanks, Heidi. And thank you everyone for joining me this evening to hear my presentation on Yomi and how Yomi has been a game changer in my practice and growing my full arch implant practice. Just a little bit about myself. My name is Kara Toulson. I'm a general dentist and I'm the owner of Dental Care of Baltimore, Owings Mills. I've been doing full arch implant dentistry since 2016, and I've been a Yomi user since March of 2023, so a little over 1 year now. This is just a general disclaimer from Neosis. I won't bore you for the details. So the topics that I'm going to cover this evening include my personal journey with full arch implants, where I came from and where I am today in my full arch digital workflow and how I've incorporated Yomi into that workflow, how I use Yomi in my strategic marketing as well as my initial consults. I'll just briefly cover how I do my initial records, how I use the Yomi software for my prosthetic and my surgical planning. And then, of course, how I use Yomi in the surgery, and then a little bit about my provisional and final restorations. So this is a picture of me and my dad. So my dad was my teacher and started me off with my full arch implant journey. So this was our first case together. He did the upper, I did the lower, and it was just off to the races from there. And we've come a long way since then. So I won't bore you with the gory details of how I used to do my full arch implants, but as you can see from this very busy slide, that it was a lot of visits and a lot of time. So I used to stage my surgeries. So I would completely edentulate my patient, put them into a removable denture, place the implants, and everything was analog. So I'm sure if you've done this, you're familiar with the verification jigs and all of those things. It took, gosh, more than probably a year and sometimes longer, and a million appointments. And the whole time your patient is, wearing a removable denture. So before Yomi, the best part about this was your patient actually got to experience being edentulous with something removable, and they were so ecstatic at the end when they finally had something fixed in their mouth. So of course, we do things much differently now. So once I became hip to the immediate fix, I started doing the denture conversions. So the advantage of the denture conversions, of course, is that your patient leaves surgery with something fixed the same day. But there were also lots of disadvantages with doing things this way. So as a surgeon, you've just spent hours doing your surgery, placing implants, extracting teeth. Now you have to go to the lab and spend another couple of hours grinding away at acrylic. Lots of acrylic dust everywhere. I learned that, okay, so now you can pay someone to come into your office to do this conversion for you, which was great, but also could be very inconvenient. So now you're scheduling your patient, you're trying to coordinate your patient's schedule with your schedule, and now the lab schedule. So I quickly realized that this was a logistical nightmare when patients need to reschedule. You forget to call the lab and let them know, the lab shows up. Of course, this is an additional cost, paying a lab to come in to do conversions. So, and then one of the major disadvantages with this is what happens when the patient breaks their denture or their fixed denture. Doing it the analog way, you didn't have a digital record, you didn't have anything to print, so you would have to wait weeks for the lab to send you something or do the conversion process all over again. So I moved to stackable guides. So stackable guides like Yomi provided me with improved accuracy. I liked that I had the ability to, really hug my sinus on the maxillary arch to increase my AP spread, which resulted in, shorter or eliminated cantilevers. And just fewer prosthetic challenges, screw access holes coming through the face of the teeth. So stackable guides like Yomi did increase my predictability, but I quickly realized that there were also a lot of disadvantages when it came to using stackable guides. One of the major disadvantages was the wait time. So the lab that I was using, and I was not making, or some people are printing their own guides. I was ordering them from a lab, and it could take up to 6 weeks for me to receive a stackable guide from the lab, which could be very inconvenient for patients who need their teeth quickly. The cost, I was spending thousands of dollars on stackable guides. And, after waiting 6 weeks, spending thousands of dollars, sometimes you go to seat your guide and you can't. It doesn't seat. And so you have to abort this very expensive, very time-consuming guide, and now you're back to just freehanding it. I also did not like that I was drilling through, a thickness of plastic blindly. I couldn't see where I was drilling. You just kind of drill and you cross your fingers and your toes, and you hope that when you take the guide off, that everything, looks the way that you've planned it. I had concerns about irrigation, how well I was able to irrigate through the thick plastic guide. A lot of times I had some prosthetic challenges. You take the guides off, you do your little conversion, the patient bites down and they're touching on 2 teeth. And then you spend another hour grinding things into occlusion. So, while I did like the accuracy that guides could provide, I also came to realize quickly that there were still a lot of disadvantages. And again, there's no digital record going this method. We would often pick up 2 sets of PMMAs, but you had these big holes that you're putting in the PMMAs, trying to seat them over your implants so you can get a passive fit, which weakens the prosthetics. Patients are breaking them. And so you would oftentimes have to order new sets from the lab, again, taking weeks and weeks of time to get your patient back into something fixed. So all of those things and the disadvantages with freehanding and with stackable guides, I knew that there had to be something better for my patients, for me. I was sitting in a seminar, progressive seminar, back in October of 2022. And one of the presenters was talking about the evolution of full arch implant dentistry, and how, we went from freehanding to stackable guides, and why a lot of dentists are moving away from stackable guides. And then they started talking about robotics. And my husband turned to me and he's like, "You're still practicing in the Stone Ages using guides." So I quickly, became very interested in robotics and how it could help me to improve my outcomes and to, eliminate some of these disadvantages that I was seeing. I wanted increased predictability, as we always do. I wanted more control. I wanted more control over my process. I didn't like having to wait and depend on my labs for so much of the process. I wanted to be able to have a patient come in and we decide when we do surgery, not allow a lab to dictate, oh, you have to wait weeks or, months to get something. I wanted to reduce my cost. Of course, everybody wants to reduce costs so that we can do more of what we enjoy doing. I wanted to engage my team. I will say this was actually one of the unintended benefits from moving to the digital workflow. I didn't realize how much fun my team was going to have utilizing Yomi. When you have a clinical partner or dental assistant that goes from sucking spit to now operating a robot, talk about excitement, right? You're able to attract top-notch dental assistants to your office because they're doing so much more and they're so much more engaged in the process. When you're done with everything, your patient is crying tears of joy because you've just changed their entire life, your whole team is around them and everybody has had a part in this journey, and it's exciting for everybody. Yomi has helped to differentiate myself in the full arch implant market. It's very competitive now. The days where just the one or two oral surgeons in the area were doing full arch implants is long gone. You have lots of clear choices popping up in lots of offices and dentists now, general dentists doing full arch implant dentistry, all in 4, all in X. Social media, you see the advertisements everywhere. There's tons of marketing companies popping up. So utilizing Yomi has really helped to set me apart from the 50 other dentists who are doing full arch implant dentistry. And of course, who doesn't have fun with their robot? Utilizing digital workflow, all of the fun toys, and Yomi has just created a lot of fun and excitement in what we do every day. So I just want to talk a little bit about how I've incorporated Yomi into my marketing and lead generation. Within a few months of having Yomi, a local news channel wanted to come in and do an interview. So they came in, they interviewed me, they interviewed a patient of mine. And I will just say that little small news segment produced hundreds of thousands of dollars in revenue. I still to this day have patients coming in and saying, "Hey, I saw you on the news. You're that dentist with the robot." So it's generated a lot of interest in our community. We use pictures and videos internally. So I have pictures and signs of me and the robot sitting outside of my office. So as people walk by, they get interested. They come in and they ask questions. I have a video clip playing in the waiting room about Yomi. I also have drip campaigns, email campaigns to patients who need implants, just to get people asking questions. How can the robot help me, to get a better outcome? So just a little bit on the actual consultation. So this particular patient, she had lost some front teeth. She was very embarrassed about her smile. She couldn't eat like she needed to. And she had gone to several other offices for consultations, including Clear Choice. But she saw my news segment and heard that I had a Yomi and became very interested in how robotics could help her. So we brought her in. We do a little digital smile workup to show her, the possibilities that full arch implants could give her with her smile. And just discuss the benefits of robotics, the predictability, the accuracy. And so ultimately, the reason why she chose my office over all of the other consultations that she had was because we had a robot and they didn't. So the initial records, We, in our office, we use the Instarisa facial scanner. And I'll tell you, this has also been a game changer. We used to send 2D photographs to the lab. Now we are essentially able to send the patient's face to the lab. So the facial scanner gives the lab a 3D image, which it allows the lab to see the occlusion, the midline, the patient's eyes in a 3D version so that you eliminate midline shifts or cants, or when I spoke earlier about, the patient bites down and they're just touching on those back molars. I don't see that anymore since I've incorporated the Instarisa face scanner. We do the intraoral scans. And again, this is all done by your clinical partners. Your assistants are doing this. So they're trained to take the face scans. They're trained to take the intraoral scans while you're able to see other patients. So all of this digital process, not only is it giving you a better outcome, but it's also helping you to grow your implant practice to see more patients. Because again, your clinical partners, your assistants are doing a lot of this by themselves and independently. With Yomi, I was able to get this patient in for a consult. 1 week later, she leaves with teeth. So the time from records to surgery is unparalleled. Again, you're not waiting for labs. You're not waiting for guides. You're able to do this very, very quickly. So I want to show you how I do my planning with this. I'm going to show just a quick clip. My lab will send me this tooth proposal in Exocad. So I'm able to view it. So you can see the teal is her pre-op, and then the white is the wax up. So I can view this in Exocad. I can turn it around all directions. And then I can let them know if I want to make any changes or if I approve it. So it's, when you look at this in Exocad, you can be sure it's going to look like that in the patient's mouth. So this is a video of the actual Yomi planning software. So when I get that STL file from my lab of the patient's wax up, I can then import that into the Yomi software. And I'll tell you, I am no computer geek by any stretch of the imagination, and this software is so easy to use. I am able to do my bone reduction planning. I am able to plan where the guide or the bone link is going to go. So that little white piece that's sticking out is the bone link. That is what attaches the patient to Yomi during the surgery. So I can plan out where that's going to be. The green represents the bone reduction plane. I'm planning that out. You can see here, I'm choosing my MUA. So I'm planning out my angle so that I can get my access through, the central fossa or the lingual, or, in the right place that I desire. So talk about control, right? Sometimes people have said, oh, you're just going to let the robot do it all. No, absolutely not. I am in full control of every piece of this process. So you can see here in green, I'm setting the boundaries for where my bone reduction is going to go so that when I go to surgery, I cannot move outside of those boundaries so I can protect the patient's tongue and the flap. So everything here is pre-planned. You can see the blue is the Yomi bone link. Again, that's what attaches the patient to the robot. Here I'm planning the screws. I'm planning not just the position of the screw, but the length of the screw, the diameter of the screw, everything down to the screw size, angle, length. It's all pre-planned here. So I can make sure I'm avoiding collisions with teeth. make sure I'm avoiding collisions with implants. So everything is very precise, and you have full control over the entire process here. And I've heard coming soon, we'll be able to also merge those spatial scans into the Yomi software, adding just another layer to be able to plan out your prosthetics and your surgical plan. So moving into the surgery, this here in this picture is what we call the Yomi Link arch. And I just want to mention here, this illustrates how quickly Neosis is able to evolve. So when I first purchased Yomi, again, just a year ago, this did not exist. This process didn't exist. You would have to numb the patient. You would have to drill and place that bone link, walk the patient down the hall to wherever your CT scanner is, and then bring them back into surgery. So of course, some of the problem there is if you have a really anxious patient, when do you sedate them, right? Because you have to take a day of surgery CT scan. Within a year, Neosis solved this problem. So again, the company and how quickly they're able to respond to a problem, or to, just provide a better workflow, a better way of doing things, is unparalleled. So here I'm just taking an impression. There's no drilling. I haven't put a needle in this patient's mouth. I have not sedated her. So she's anxious. So all I'm doing is taking an impression tray, and it's nothing more than PVS bite registration. And I'm seating it over her teeth. And then I'm going to walk her or wheel her down the hallway, and I'm going to take my CT scan. So again, I have not drilled anything. I have not put a needle in this patient's mouth. I have simply taken an impression on her teeth, and I'm taking my day of surgery scan. Once that is done, now I can take her back to the surgery room, and now I can sedate her. Once she's in the surgery room, I sedate her. Now I'm linking her up to the robot with that impression tray, and I'll use this to now place the bone link in a guided mode to be exactly where I planned it. So I'll play this video here.
Great.
How that is done.
Really, really still. You're doing great. Guided.
Going guided. You got tilt down. Move apical locked in. Almost to crest there. Crest at depth.
Can I have free?
Free.
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 So you can see
Pause.
how quickly
And I'll hold it
this
while you
bone
go.
link is placed. This has been taking 15, 20
Take it
minutes.
easy. Take it slow. You want to make sure
People
you get
have
it
said,
in the right.
Oh, it takes too much time to place the bone. This is
Feel like it.
5 minutes left.
Okay, good.
You got it right there.
Guided.
Guided. You're gonna tilt to be locked in.
And again, I've pre-planned it.
Crest at
Free.
depth.
So my screws are in the position where I want them.
Pause.
Pause.
There's no
Got it.
guesswork here. Everything is precise and accurate.
And then when you're
With
done,
three
you put the
screws.
other one down more.
And that creates a very rigid link here. So once that bone link is in place, now I'm ready to flap and I'm ready to take the teeth out. So one thing that I want to point out here is when I was doing stackable guides, in order to seat the guide on the bone, I had to create these really large flaps just to get the guide to seat on the bone. You can see here, this bone link is actually placed on top of the flap. So my flap is determined, the size of my flap is determined only by my bone reduction. So if I have a lot of bone reduction, then I lay a bigger flap. If I have just a little or no bone reduction, I lay a little flap. So the flap is not dictated by my guide. So it's just dictated by how much bone reduction I need to do. So it can be very minimally invasive, which was again, just with the flaps, the sizes, it leads to less discomfort for the patient, less swelling, as we all know.
That's true.
I'll go to the next slide. So this is a quick video of the bone reduction. So in the software, when you're in surgery, you will see the screen, you'll see what you're doing. And so I'll show you the screen, and then I'll show you how it looks in the mouth as well. And
So one thing I did. Doing
then set my boundaries so that burr will not go inside. I'm not hitting the flap, the tissue flap. I'm not hitting the tongue because I'm restricted. So I've created those boundaries. So that creates, a restriction so that I can't, inadvertently, get the flap caught up in my burr. So just again, increasing the safety during the surgery. So once the bone reduction is done, of course, you're going to go into your osteotomies, and I'll play this video.
and guided.
Guided. Move closer to number 4.
So
Twist
you
your
can
hand
see
feet.
again, here's the screen, so you
Other
can
way,
see
twist out, yeah.
what your angle
Open
is
really
looking
wide.
like as you're in the
A
mouth.
little, locked in.
Here, the assistant is giving me feedback.
Water, okay?
Press, 2,
Back with the robot.
2, 3, 4, 5, halfway. Then at depth,
3.
3,
Next.
7. Going guided.
Open really wide.
So I place my MUAs. Again, all of this is pre-planned. I choose my angles before surgery. Once the MUAs are in, I place my dominoes. I take my ICAM scan. Again, this is done by your clinical partner, your assistant, while you go grab a cup of coffee after you finish the surgery. This is leading to it's just so accurate. The restorations, they're so passive, they just drop in like butter. The ICAM, the Instarisa, and the Yomi is just a game changer combination. So once you're done with your scan, your ICAM scan, then you're going to place these soft tissue caps. These soft tissue caps here, this is from the iMetric Instarisa makes a really nice abutment as well. So kind of drafting your and then you So once you're done suturing, for those of you who are not so familiar with the digital workflow, you have to have some kind of reference. And so we use what we call artificial reference screws. And this here is this is one of the Instarisa artificial reference screws in the palate, because the lab needs something once the teeth are out to reference back to your pre-op plan. What I have found is sometimes it can be very challenging to scan these reference screws. They're shiny, they're metal. So you can see I've used, Instarisa makes this spray. You can spray to help with the scan. Sometimes, especially on the mandible, I have found it to be quite challenging getting reference screws in the retromolar area. Either the patient has very limited opening, it's hard to see back there. There's a lot of bleeding sometimes. The tissues can be movable. So one of the really nice benefits of using Yomi that I have found is your bone link is your reference. So you can kind of skip the extra step of having to place a reference screw. And I have found that I don't have problems scanning the bone link. My scanner in my office, we're able to scan that bone link with no problems every time. And we're getting great alignment and it's very predictable. So once the scans are all done, of course, you send everything to the lab and they're going to send me a design within 30 minutes. So here, my clinical partner, she is using Sprint Ray to print the provisional teeth and staining and glazing. And all of this is accomplished in about 1 to 2 hours, while the patient can either rest and watch Netflix, or sometimes the patient will choose to go home and come back the next day. So here you have before and then after the day of surgery. And then for final records, it's all pretty much the same scans. I usually will take another ICAM scan for implant position. I will take another soft tissue intraoral scan, and then I might take a face scan if I want to make any changes to the aesthetics. But one thing I want to mention here is that because of the face scanner, we're not doing 4, 5, 6 try-ins. We're doing 1 or 2 try-ins. And most of that is actually going to be accomplished at the day after surgery. So we'll put the teeth in. If we haven't nailed it on the first try-in, we'll make the little tweaks and then we'll put the second teeth in. So by the time that you're at the stage of final records, there are no changes other than the soft tissue. So that's my workflow. That's the evolution of things. I will say that Yomi has just really enabled me to provide my patients with the very best in a shorter amount of time. My outcomes have been just amazing. I mean, I have again, very minimal try-ins. We're able to get to the target much quicker, much more predictably. And, you know, these patients who come to us, they're not, you know, it's not just their teeth, you know, they have a whole story behind how they got to where they are, whether it was trauma or just neglect or disease. You know, these patients are coming to us because they have a history of pain and suffering and neglect and embarrassment, not being able to eat with friends, not being able to go out, not being able to get a job. And we're not just putting in implants, we're changing these patients' lives. And why not give them the very best? They're investing a lot in us and a lot of money, a lot of time. Why not give them the best, the most predictable, and the quickest outcome? So in my next slide, I just want to show a really quick video clip. This was a friend of my husband's. He lived out of state. He had severe periodontal disease, a lot of loose teeth, you know, had neglected his mouth for quite some time. And we knew he wanted to do something, you know, wanted to come in and get some work done or get a treatment plan. And we had kind of talked about it. Well, one day on a Sunday or Saturday, he called my husband, and unfortunately, he had taken a fall and shoved his front tooth way up in the gums, and he was in a lot of pain. And as I mentioned, he lived out of state. So my husband says, hey, you know, do you think we can get him in tomorrow? You know, can you just clear up some time just to get him in and see what we can do for him? Well, we got him in on a Monday, we did our records, and within 72 hours, we changed his whole smile and his life, to be very honest. So I just want to play just a quick clip, just to show you how Yomi just has allowed me to provide this type of service for patients. What are you hoping to get out of this today?
I'm just hoping to get my teeth in line so that I could have like a perfect smile. So when I talk to the public, I feel a little more confident.
Yeah.
That's basically it, because I talk to a lot of kids and stuff.
How about eating? Are you looking forward to eating some real food?
Yeah, I haven't eaten real food in a couple of weeks. I had a bad experience. Yeah, not good.
Well, I'm excited. So we'll be back in a few hours and show your new smile.
Thank you. Nice? Yeah. Once you like it, I love it. Damn!
You look good. Looking good. Yes, sir.
Yo, you could go on a business meeting now.
So that brings me to the end of my presentation. Again, Yomi may not be for everyone, but for me and for my practice and for my patients, it has been a huge game changer. And I don't ever imagine doing my full arch implants without it. And if you have any questions, I'll be happy to answer them. Thank you.
Thank you, Dr. Toulson. And again, I want to remind everyone that there is a Q&A box at the bottom of your Zoom link, and please feel free to type in some questions. We do have quite a few that have come in right now, Dr. Toulson, if you wouldn't mind answering them. So the first one, I love this question. How do you determine what is a Yomi case and what is not a Yomi case?
That's a great question, Heidi. And I'll be very honest. I have not placed a single implant without Yomi since I got it. Everybody is a Yomi case. The accuracy is unparalleled. It's not beatable. The control again that I have over single implants, because I do those as well, to my full arch, and the speed at which I can do it. The reduced cost, not having to pay for guides, not having to wait on guides. Every case that comes through is a Yomi case for me.
That's fantastic. I love that answer. And thank you for being so honest. The next question we have, does Yomi provide any training, and how do you to use that workflow?
Yes, I'm glad that someone asked that question because yes, Yomi provides very thorough training, not just for me as a dentist, but for my entire team. I'm over a year in and I still have a trainer that comes in. So for example, I told you that they've introduced a new workflow to be able to take the scan before you sedate your patient. Well, I didn't just YouTube or watch a video. Someone came into my office and made sure that we understood how to do it. They were there for the first, second, third case until I felt comfortable and like, okay, I got this. I don't need you to come in anymore. But they're there for most of my cases, if not in person, virtually. And they do not leave you out there to dry. The training is intensive and the ongoing support is incredible.
Thank you. Thank you. That was a great answer. Next question. Is it for beginners or recommended for experienced clinicians?
So I do believe it's very important for a dentist to have a good solid foundation in implants before moving into robotics. Just in the event there's a power outage and you need to go ahead and freehand something, you should always have a really solid foundation in prosthetics and surgical training. But I will also say that, once you do have a solid background and you feel comfortable that you can always freehand something, you can very quickly move into utilizing Yomi. My associate has used Yomi to place implants. It was very, very easy for her, and she's, just starting out. So I think that having the foundation is important, but I don't think you have to have years of experience before you can use Yomi.
Great, good question. Now we have another one. Is how many implants do you need to break even with this investment? And then the next question following is very much on par. What is your view on ROI? I'm assuming that means on full arch.
Okay, on full arch. So, yes, obviously Yomi is a sizable financial investment. And I have a lot of people who say, well, how do you justify the expense of purchasing that robot? Well, I will tell you the break-even point for me is 3 arches. So anything more than 3 arches in a month, I have saved money and I'm making money. And that's just my break-even point with if I'm comparing it to when I was purchasing those surgical stackable guides, because I'm not doing that anymore. So my break-even is 3. But as I mentioned, the increase, using Yomi in my marketing and the increase in patients coming to my office because I have a Yomi, it's more than paid itself in just the year. More than paid itself for itself.
Thank you. Next question. For your full arch cases, are you running into situations where your bone fixation screws hit teeth of planned implants? Or it must mean or planned implants, I'm assuming.
Yes, and so that goes back to that the evolution with the Yomi Link Arch. So prior to using Yomi Link Arch, you were placing the bone link free-handed, right? You kind of plan it out in the software and then you kind of eyeball where it will go in the mouth, but it wasn't done in a guided fashion. And so there were times where the planned implants would collide with the screws. But we would get around that by just moving the planned implant over, which takes just a few seconds. Again, this is a very dynamic plan. This is not set in stone. So after you see that there's some kind of collision, you just click, 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 move your implant over. But now with the Yomi Link Arch, now that's been eliminated because you're planning out where your screws are going to go. So you're avoiding those collisions.
Thank you. Great. There is a general comment I would like to share. As my root canals failed over the past 25 years, I've had 15 implants. The last 3 were with Yomi. Yomi implants are a quantum leap above the best surgeons. So thank you for that comment, whoever put that in. We do have and I think this is a good question coming in, Dr. Toulson. I want you to clarify this. You told us that you have the control all the time, so I don't understand the difference with conventional technique.
Well, there's the free handing and then there's the surgical guides, right? The stackable guides. So I'll compare it to the stackable guides. Um, they're made in a lab. They're static. They are what they are. So there have been times where I will go and try to place it and pin a guide and it doesn't fit. Right. So then what? Now what do you do? Now you're just kind of going back to freehanding. Um, there are times where I'm using a guide and I don't necessarily like the position of the implants. You can't change a guide. Once you have a guide, it is what it is. With Yomi, I'm visualizing the bone as I'm drilling into the bone. There's nothing in my way. So if I plan an implant and I'm drilling and I'm like, I don't really like that position. Well, guess what? I click, 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 and now I have changed my position. So it's dynamic. You can change it. You can change it on the fly if you don't like something. I like the control over the time. Again, the time that it takes from start to finish is so dramatically reduced versus waiting on guides. The control of just my hand, sometimes when you're freehanding, when you're not using guides, I'm often looking like, okay, am I in the right position? I will say that your torque values with Yomi are so high because you're going right to the same spot every time. Your hand isn't moving. You're not able to move. So when you're drilling, you're creating a very, very tight osteotomy. So you're getting really high torque values. So there's just control over all aspects of it. Again, from the prosthetic planning to the bone reduction, to the implant placement, to the MUA angles, you are in control over all of that from start to finish, and you can change it at any time.
And I think the other key I'm going to add into that for the question is I don't know if you were able to hear in the videos that we're playing, but when you are planning your case and you lock it in, you are still holding the handpiece, but you'll hear the doctor say guided or free. And once you're guided and locked in, it doesn't move. So even though you're controlling it, you can't go beyond the depth of what you plan. It will not allow you to move off that plan until you say free. So I think that's the piece. And whoever asked that question, I encourage you to have a demo and feel the haptic guidance kick in. Once you feel it, you'll know exactly what we're talking about here. So that was great. Okay, a couple more questions. They keep coming in. How long did it take your team to get comfortable with the robot?
So I've been very fortunate. I have an amazing team, but I would say probably about 5 or 6 cases, and however quickly that takes you to get through before we felt comfortable like doing it on our own. But again, it's things evolve. Like the software is getting better. We've introduced the YLA. So we're evolving, but I would say probably 5 to 6 cases before we felt confident to do it without the trainer being present.
Great, that's wonderful. And that's the goal. Obviously, we want to train you and get your team comfortable and let you become procedurally independent so we don't have to interfere with your workflow. A lot of questions about the Instareza and why you feel that you need to use facial scanning with Yomi.
Oh, because I don't like grinding into occlusion. I mean, the facial scanner, it allows you to more predictably plan your prosthetics. I mean, just in a nutshell. I don't know about you, but when I was not using the face scanner, I was dealing a lot of times you drop the teeth in and the midline is over here. Or there's an open bite, or there's a cant. So the facial scanner just eliminates all of that. It gives the lab, other than sending your patients head to the lab. I mean, it's the next best thing. So they're able to manipulate that 3D so that your occlusion is spot on, your midline is in the middle of the face. You don't have these cans because they can see the eyes. So the facial scanner had, in combination with the Yomi and the iCam I can't see doing full arch without them.
Great, that's wonderful. How often does Yomi version get updated, and what is the lifespan?
Oh, Heidi, maybe you can answer that question better than I can.
I wish I
don't
had
know.
a crystal ball to tell you how often it gets updated, but what we can tell you is that we do update it, and that is part of what you get as being, with the membership package. All of this is included. And you get the updates regularly, right, Dr. Toulson?
We sure do.
So let's see. We have another one. I do not have all the equipment that Dr. Toulson has. Do I need it?
Yes. So, I went all in. I really did, because in my mind, I couldn't wrap around doing it and missing one of these pieces. So, I tried in my mind. I was like, well, what if we just skimp out and do it this way without this piece of equipment? But what I realized is that by having the Yomi, the face scanner, and the iMetric iCam, and having all three pieces, it's how we do what we do. For me, in my practice, having all three, it makes my job easier. It makes things more predictable, faster, and more fun. Now, I do know that there are ways around the, you don't have to have photogrammetry to get a passive fit. Instarisa has a nice workflow that I did use with scan bodies, so you can get a very passive restoration using just your intraoral scanner. So, there are definitely ways around the photogrammetry, but for me, the Yomi is essential. The face scanner is essential, but you can definitely work around the iCam if you want to cut on something.
And I think that's
also, and then one more piece. Go ahead. Is the 3D printer. You got to have a 3D printer if you want to be able to deliver teeth same day. Sorry.
No, that's great. And I think that back to the earlier question, is this for beginners or full-time clinicians? We have a lot of customers that are not as full arch focused right now, and they want to grow their full arch business. So we always have an expression. We say you have to crawl, then you walk, then you run, and you are clearly running fast. So it is not, you don't have to have everything to use Yomi. And our goal is that we can help you grow your practice and grow your full arch portion of your practice to get you there. So that was fantastic. So I love all these questions. There's two more we have that I want to definitely hit. And I love this one. When you show a new patient the robot, what is their reaction? Are they afraid?
That's such a great question, because initially that was my concern, right? Oh, patients might be afraid of having a robot, but I have not had one patient say that they were fearful. Not one single patient say that they were fearful because a robot was going to be assisting me with this process. I think that in medicine, robots are very prevalent. I have family members who use it in OBGYN. I have family members who are in orthopedics. They both have been using robots for a number of years. So I think patients are more familiar with robots now than they were maybe 10, 15 years ago, because they're very prevalent in medicine. Yes, they are new in dentistry, but robots, technology, it's becoming standard in other areas. And so I think my patients have been very excited, like, yes, finally, somebody caught on that we got to do it in dentistry too.
That's great. And to add on to that, we absolutely not only train your clinical team in your practices, we work with the business team, helping them understand the right verbiage, how to talk to patients, how to approach this from every angle. So by the time that patient does get in, they're perfectly comfortable and understand what is happening in the practice. So that is very true. Are there any type of implants that aren't compatible with Yomi?
No, Yomi works with any implant system, any drill system. It's essentially, it's just a handpiece that's connected to the robot, and you can use that with any system that you want.
So there's a question here, and I'm going to answer it for you, but I want you to answer it as well. Why did you decide to go with Yomi versus all other options? It is the only FDA-approved robot in dentistry, so there are no other options as far as robotics. So that's a factual thing. Now let's hear your personal take on that.
Well, yes. If you're going to compare it to other robots, yes, there is no other option. But the reason why I chose to invest in Yomi was because I was not happy with where I was using my stackable guides. There were so many issues that I was having, as I pointed out in the earlier slides, and I knew that I could do better. I could give better. And I didn't know what better was, but I took a leap of faith. I demoed the Yomi. I talked to other Yomi users who were having great success, not just one, but many. And I took a leap of faith because it's new, and everybody is afraid of new. I had a lot of people say, oh, it's just the new fad. You're not going to be able to do every case with it. It's going to phase out. Well, that is absolutely not been my experience. I'm so glad that I took the leap of faith because, like I said, I cannot imagine going forward doing full arch or implants without Yomi.
So the last and final question, what would you say to the skeptics out there that are saying you don't need Yomi?
Well, you don't need an iPhone either. You don't need a Yomi. Of course you don't. But what I will say is by incorporating Yomi robotics in my practice, it has helped me to grow in a very short amount of time. My full arch implant practice, I was doing just a couple a month. Now I'm up to almost 10 a month in a year's time. Patients are coming because they want the best. And I will tell you, by being a Yomi user, you're going to be the best in town and patients are going to come to you.
That was a beautiful way to end this very informative webinar. I encourage any of you to reach out. We will be reaching out to you with follow-up, but get a demo, feel the experience, and let us help you change your practice. Thank you, Dr. Toulson, for sharing all your insight and your knowledge and your beautiful presentation. And we thank all the rest of you. Have a great evening.